Bismillahirrahmanirrahim. The concept of site-specific regeneration, specifically for nervous system, is discussed in this video. Following are the references for this video. The mature neurons are mostly postmitotic and have very limited regenerative capacity. The peripheral nervous system uh, has got some regenerative capacity, possibly via axonal regrowth. The CNS or central nervous system has got minimal regeneration and mostly reorganization occurs between the existing connections. There are some exceptions in the CNS where in olfactory bulb and hippocampal dentate gyrus, there the neuron can be generated from neural stem cells. So these multipotent precursors may allow future neural repair therapy. The analogy that can be used for to understand this concept is broken electric wiring versus minor rewiring, where completely snapped wires that are neuron are hard to reconnect, especially in CNS injury, but minor frayed wires may be repaired partially. These minor wires are PNS or peripheral nervous system axonal regrowth, while in a few rooms, such as in olfactory bulb and hippocampus, new wires can still be installed by the neural stem cells. In the central nervous system, if there is damage to the brain or spinal cord, there is growth of capillaries and gliosis. There is proliferation of astrocytes and microglia. There is gliosis in the CNS that is equivalent to the scar formation elsewhere, and this is permanent once established. This glial scar acts like scar tissue in other organ, but here it blocks the axonal regrowth. The time sensitivity of axonal regeneration uh, if is around up to 2 weeks. If there is spinal cord injury, there is outgrowth of the axon up to 2 weeks. But if there is release of myelin associated glycoprotein and chondroitin sulfate, they ensure the gliosis that prevent further regrowth. In the CNS, however, axonal regeneration occur only in the hypothalamic hypophyseal region, where in that area the glial and capillary barriers do not interfere. If the severed end of a nerve are perfectly aligned, axon can regrow and re-innervate target tissue. The factors that facilitate this regeneration are Schwann cell. They play a critical role by forming the regeneration tube and producing laminin and nerve growth factor. The laminin serves as a guide path because it is a basement membrane protein, while the nerve growth factor promote axonal sprouting and elongation. The blood nerve barrier, it remains open for 2 to 3 months, allowing better exchange of the trophic factor. The failure of regeneration will lead to the development of traumatic neuroma. If if the ends of the cut are not aligned properly, or if the scar or inflammation blocks the pathway, a neuroma is formed that is a tangled mass of regenerative axons, Schwann cells, and fibroblasts that may result in pain, sensory deficits, or no functional recovery. The injured nerve is like a broken railway line, and the Schwann cells act like railway workers, rebuilding the track, guiding the axonal regrowth via laminin and neuronal growth factor. If tracks are perfectly aligned, the train, that are nerve signal, resumes its journey. If misaligned or obstructed, a tangled pile of rail and debris, that is neuroma, is formed, stopping the traffic. This is a traumatic neuroma that is stained by trichrome stain, where the collagen fiber are stained as these collagen fibers are stained as blue colored, and muscles and axons are they are stained as red, pink or red color. So you can see a bulbous disorganized mass of regenerative nerve fiber, disorganized mass of regenerating fibers, and the pink red bundles in the center. These represent the proliferating axons or nerve fiber. Surrounding these axons, there is abundant blue stained collagen, indicating fibrous tissue formation. Proliferation of Schwann cell and fibroblasts contribute to the disorganized appearance. The architecture is haphazard and axons are not aligned properly, which is why functional nerve conduction cannot be restored. So this arrow, they are pointing towards the misdirected bundles embedded in fibrosis. These misdirected bundles are embedded within this blue fibrosis, hallmark of a traumatic neuroma. This structure results when a severed peripheral nerve attempts to regenerate but fails to reconnect properly and encounter barriers like fibrosis, inflammation, or misalignment. So these conditions may be painful and lead to sensory deficit or neuropathic pains. Thank you for watching this video. If you have any question, please write in the comment box.